Well, our next topic is erectile dysfunction. Doctor, what do we need to know about erectile dysfunction?
Erectile dysfunction is the inability of a man to keep his penis rigid or to maintain an erection during sexual intercourse. And on some occasions, it is impossible, because of flaccidity in the penis, to penetrate the vagina. All this causes an enormous problem in the couple's relationship because the man gets the woman excited to have sexual relations, and no matter how many times he tries, there is no erection or rigidity. His penis is semi-soft. This can make sexual relations difficult. When a man has erectile dysfunction and or premature ejaculation, and because of shame or machismo, he doesn't go to a urologist, this deteriorates the couple's desire for sex. This leads to boredom, indifference, and rejection. Therefore, in order for us to classify what erectile dysfunction consists of, we need to talk about 3 different categories: normal intercourse, an average level of dysfunction, and serious dysfunction. Normal intercourse is when the male penetrates the vagina with a rigid penis, he ejaculates, and he withdraws with his penis semi-hard or semi-rigid, and he enjoyed the intercourse. That is good sexual intercourse. An average level of dysfunction is when the male starts with his penis semi-hard or semi-rigid, but he is unable to penetrate the vagina. We call this average dysfunction, or as well, when he starts with a rigid penis, but a change in position or a change in movement or a slight distraction causes the penis to go flaccid within the vagina. We call this average dysfunction. Serious is when no matter how much he tries or how much his partner tries to excite him, his penis never becomes erect.
I imagine there are other factors involved here.
Yes, of course. Erectile dysfunction is multifactorial. There are a lot of factors that we can attribute to this. One of the factors is diabetes, high cholesterol, high triglycerides in the blood, and hypertension. Sometimes people may ask me, why hypertension? This is simply because of the medications the hypertensive person takes. We need to know that to have a good erection, the cavernous arteries fill with blood, and when this happens, the penis becomes erect. So when a patient is taking a high dosage of medication for hypertension, it lowers blood pressure. It would be good if it just lowered the blood pressure to the arms or cardiac pressure and did not lower the blood flow to the cavernous arteries. A large amount of tobacco smoking is a very significant factor in erectile dysfunction as well. Alcoholism, drug addiction, and obesity are also very significant problems. Emotional disorders with a partner can cause erectile dysfunction as well. Now, we are entering into the psychological realm of erectile dysfunction. Many times, I tell my patients, communicate with your partner, because even if I give you the best medicine or treatment in the world, and you have emotional problems with your partner, you're not going to have good sexual relations, or you will never be able to have a good erection. So now we can include, because we're not going to forget it to include, age as well. Many times age, with time, gradually deteriorates the cavernous arteries. If a patient doesn't go to a urologist, his erectile dysfunction will continue to increase.
So we have to go to the urologist at what age? 20-something, 30-something, or 40 years of age?
At the moment erectile dysfunction appears, you have to go see a doctor immediately to treat this specific illness.
Yes, normally we believe erectile dysfunction starts at an advanced age, like the age you just mentioned. Then why, because we know it exists, does erectile dysfunction frequently present itself in young people?
We know that a lot of youth or children at the age of 10 to 12 start smoking and start drinking alcohol. From these, they can jump to marijuana and then cocaine. All of these vices cause the deterioration of the internal part of the cavernous arteries, or the internal part of the vein. And it happens in very young people. I have seen people in my office at 21 years of age who already have problems with erectile dysfunction. They already have a very serious history of addictions like the ones we have already talked about. So sadly, we can see from a clinical or laboratorial point of view, through test results, of course, that this is the cause of their erectile dysfunction. With the test results, we can give medical treatment and follow-up treatment for 3 to 4 months. Of course, we have to regulate the patient from a hormonal point of view. We have to help him from a psychological point of view, and we have to give him medical treatment that helps the patient gradually, little by little, stabilize and obtain good functionality.
It has to be a multifaceted treatment because if I am obese, first I need to lose weight, right?
Yes, of course. We can say that all erectile dysfunctions have a solution. First, we form a clinical history of the patient, then we run lab tests, and we do studies. And then we start with the medical treatment. So after we start his medical treatment, the patient should start to respond. If for whatever reason he doesn't respond, it is usually because he is very unbalanced. For example, he's diabetic, etc. We then give him an intracavernous injection for the penis that he takes home and uses 5 minutes before sexual intercourse. This will cause a very quick erection.
Does that really hurt a lot?
Well, yeah, it never stops hurting.
But it's worth the pain.
It's worth the pain, yes it is. Now, when neither the medication nor the intracavernous injection works, then we have to insert a prosthesis.
So, even if a person is sick, he can have good sexual relations. Because if not, he has reached the bottom of the barrel. I mean, he's sick, diabetic, and obese. And besides that, he cannot even have sexual relations? Come on. So, with this, he can have an erection?
Yes, of course. He can have an erect penis, but he should watch himself. He should go to a nutritionalist, and he should do exercise in order that at some point his dysfunctional problem will improve. And finally, like we mentioned before, when the patient doesn't respond to drugs and doesn't respond to the intracavernous injections, we place a prosthesis. That prosthesis is the famous pump. Yes, the famous little pump. It is made up of 2 cylinders that are introduced into the cavernous arteries. One of these pumps is called the Ampicor, commercially. This is composed of 3 parts. The little pump that goes alongside the testicle and through the scrotum that contains liquid that gets injected and which makes the penis rise. It looks like the penis that is rising, but what is really rising is the prosthesis. There is also a different design that is malleable. With this prosthesis, we simply put 2 cylinders into the cavernous arteries and the patient can manipulate his penis into any position he wants. This solves the problem of erectile dysfunction. Normally, when this type of prosthesis is required, it is because prostate cancer has been detected in the patient, and we need to remove the prostate in order to save his life. The urologist tells the patient that we have to perform a radical procedure. We have to remove the prostate and get rid of all the ganglia in this area, etc. It is very extensive surgery. Sometimes, due to complications, the surgeon has to remove the pudendal nerves. These are the nerves that help with erectile dysfunction. The patient is going to sometimes have, because of damage to those nerves, erectile dysfunction. The urologist has to tell the patient, you have cancer, and I need to remove your prostate in order to save your life. As a result, you may have problems with erectile dysfunction, and you may lose the ability to feel the need to urinate. So it's surgery or your life. The patient normally elects surgery in order to save his life, of course.
In the great majority of the cases, the message is that this is curable. There are treatments. One shouldn't resign himself to a life of erectile dysfunction. Don't just give up and think that it's just bad luck.
Yes, as we said before, it is very serious when the patient, because he doesn't take good care of himself, is obese or he has high cholesterol because he eats red meats or animal fat, etc. The patient cannot permit his cholesterol and triglycerides to reach such high levels. Many times, a patient comes into the office obese and says, "Doctor, I have erectile dysfunction. What can you do for me? The first thing the patient needs to do is get on a diet and start exercising. I then put him through a battery of tests and then start treatment. Then the patient will start to gain functionality from an erectile point of view. And obviously, his relationship with his partner will improve.
Health is synonymous with having a good sexual relationship or a good erect penis.
Of course, causes of erectile dysfunction range from mental health issues to, as we have mentioned before, all types of physical disorders. It can start in the bedroom. It can get to the point that the couple decides to get a divorce. Why? Because the wife is fed up with struggling and suffering in the bedroom with this very intimate and private issue.
She says, I'm just a baby factory. I pump out kid after kid and never enjoy the process.
Then the couple gets a divorce. They go before the judge. The judge wants to help them, and he asks them, why can't you work out your problems? But they are embarrassed to talk about his erectile dysfunction, so they end up saying that they have the normal marital issues and never mention the dysfunction.